So I'll be talking about corporate health issues pre-COVID versus post-COVID. What was happening? Uh, Having been an auditor of health and safety for many years now, what I have seen, the first part we'll talk about is the pre-COVID scenario. What was going on, and then we will talk about post-COVID scenario. First part, level of awareness and understanding. I'm not talking about COVID. Before COVID, before March, perhaps very few of us knew about what it is all about. But yes, at the workplace, we all needed to know the health and safety issues connected. Typically, I'm talking about the health and hygiene factor. That what kind of hygiene factors to be taken care of at the workplace. The understanding was more ritualistic. And understanding was also there, but then once people go on working, they forget about all these factors, like people working in a say yarn making or some other place. They forget about that the dust carries lot of particles uh, of yarn, and that goes into their lungs. Typically in cement industry, I've seen people using some kind of handkerchiefs or gamcha on their nose, the workers. There's some echo. Are you able to hear me?
Yes, yes.
Okay. So so this kind of awareness were there by compulsion, but not with conscious effort. Then management were not equally not committed to it. That they are mostly connected to the profitability, production, productivity, and all this. But health and safety is always taking a back seat. If at all they have to do something, then they'll appoint a first aid master or put a first aid box somewhere containing some kind of medicine, some dressing material, and all. That is all. Nothing beyond that. And at the best, they'll put some banners inside the plant about health and safety, but nothing beyond that. The issue was of the resources also. There was no thought that you have to assign somebody who is responsible or to make people aware people are using those PPE, so to say, at the workplace. Then level of implementation, certain regulations. Mr. Trivedi talked about Factories Act. Factories Act is very clear about all health and hygiene factor at the workplace inside a factory. But the implementation is basically ritualistic, that they want some rules that they display it on the notice board and they feel that's enough. The implementation part, there was no one to check. The safety officer also takes around and bits of pep talk to some people, and that's it. His job is over. Now coming to the post-COVID scenario, which is more pertinent today, and we have to keep our focus more on that. The first part is meeting the regulations and international standards. The regulations issued by our PMO or the ministries and health and safety authorities, at the Factories Act as well, and there are international standards like ISO 45001, which talks about risk orientation. That 9001 talks about the business risk, but 45001 talks about the health and safety risk. If at all you are not abiding or you're not following the standards prescription, then what kind of risks are there? Ministry of MSME has also under that ministry, QCI, Quality Council of India, they have created an initiative called WASH, Workplace Assessment for Safety and Health. There's a scheme started, but somehow it is not picking up. It's not gaining the kind of popularity it should have. The industries are not interested for their obvious reasons. Even ISO 45001 we are talking about, the scenario is that it is customer driven. If the customers are insisting, typically the foreign buyers, they say that we wish you to have this kind of standard certification, ISO 9001, ISO 14001 for environmental pollution, and ISO 45001 for employee health and safety. Then only we'll buy your product or services. That compels the industry to some extent. But meeting the regulations and international standards are very important now, and the actions taken by the concerned authorities also very severe. So one have to be very careful about that. The risk management orientation I talked about. Again, I'm talking about ISO standards. Initially, when it was started, they used to talk about documentation. Write what you do and do what you write. That applies to product quality, service quality, even in health and safety. But the orientation was weak. Now they talk about think of risk. If you are not aware of what kind of risk you have, you think of a person. I saw a lady security guard at one of the factory gates. She was using chunni for covering her nose. I told her that you are trying to show me as an auditor that you are complying to the covering the nose, but face mask has no substitute. This chunni is not enough, and because every time you change the position of chunni, the other portion will come, and perhaps you will keep the infected part on your nose. All risk is yours. And the most important part I shared with that lady was that risk is yours. You are sitting at the gate, hundreds of people coming and going out, and you are coming in close contact with them, checking their gate pass and all kind of things. Sometimes you have to go for body search also. All risk is yours. You forget about compliance, forget about regulations, forget about rules, forget about what your supervisors say. Think of your own health for your own family and your society. Then the most important part is training and awareness. People need to be trained that how important it is. I have seen the effect is also being seen in family. I have seen a 4-year-old boy washing his hand on a wash basin and counting up to 20 before rinsing his hand. So this kind of awareness has gone into even a baby boy, baby children also. So that awareness has to go up. Something has already happened, but that is not enough. We have to keep on hammering. Secondly, training and awareness is effective only when it is implemented. The level of implementation can be ensured only when you keep on hammering again and again. Just telling them that be safe, practice safe thing, cover your nose, the 3-point of the ministry that cover your nose, and then maintain safe distance, wash your hands and all that. You have to keep on repeating, keep on telling, and keep on pointing out. The supervisors, typical at the shop floor, and the line managers need to keep on pointing out that anybody not wearing nose mask will not be allowed to work at his workstation. Then comes provision of resources. We have to provide at many industry. We have seen that they are using. They started providing the sanitizer dispensing machines. Sometimes it is automated, non-contact, and all that. That is not enough. Let us think little more on that. For example, that even healthy persons should inhale steam at least twice or thrice in a day. Why not have a steam inhaler at the security gate? The security guards who are exposed to so many people, they're open to air, the open atmosphere. So whenever they go for tea break, why not inhale couple of inhalation of steam after taking cup of tea? Because for them it is very important, and this resource is not very expensive. Like we talk about sanitizing, in many of the offices I have seen they are using ultraviolet sanitizer for mobile phones and even diaries and all that. But it is to go deeper. It has to spread widely. People should use it at every place, every location. Even for the product, many countries They don't accept your material if you put them on a wooden pallet, and those wooden pallets are not properly fumigated. Typically, country like Australia, I remember 30 years ago when I was exporting materials, aluminium and all that, they wanted fumigation certificate by a authorized agency. Then only the material can be shipped to that country. So that is one small example that is already in practice, but now it has to go for all other products also. Imagine an office buys a pack of bulbs containing say 2 dozen bulbs in a pack. If there is something wrong, then every bulb will spread its infection to all these locations wherever you are putting in. So that means we have to go for taking precautions or taking preventive measures at the source only. Why not the company who is sealing that, packing that packet of 24 bulbs in a box? They sanitize it, and sanitization doesn't cost a fortune. They can go for ultraviolet. There are other methods also like gamma rays and all that. So that technology is available. It may be one-time expenditure, but yes, it is very much needed. Another part is very important, the supply chain, where from the material comes. You never know. You are unpacking a raw material, incoming goods. It may be infected, it may be carrying the virus. So the responsibility is on the supplier. At the same time, think of the truckwala, think of the helper, think of the workmen, the workers, those who lift those containers or boxes onto the truck, and the unloading and loading and unloading part. Even at the midway, some authority police checks those containers for whatever reason. Are they sanitized? Or after that, after their inspection, is it sanitized before repacking it? We have to make it sure that entire supply chain management is tuned to this kind of post-COVID scenario and precautions and all that. Then another very important thing is sanitization of incoming and outgoing goods. Simple ultraviolet rays sanitization is very simple. It doesn't cost a lot of money, and it doesn't take time. Simply you pass it through tunnels. In many of the industries it started, they have created a walkway tunnel through which the employees pass, and there's some fog or something to sanitize their whole body. Why not do that for all the incoming material to a factory? Same thing for outgoing goods. In the final inspection and packing stage, go for sanitization. Put a sticker onto it. Like in a hotel, you see in the toilet seat that this commode seat is sanitized for your health and safety. Same thing can be, small sticker can be put on a box so that the one who receives it feels good about it. Yes, the person who has packed it for me with all love and care, with all precaution, and this is 100% safe for me or for my workmen. This has to be there. Forget about rules and regulation. Forget about what the standards are talking about. Again, going back to ISO 45001, occupational health and safety audits. The standard nowhere talks about COVID, but nonetheless, I have seen the auditors, including me, we talk about COVID preparedness. We go to any organization while auditing, we do ask questions. What is their COVID preparedness? That is also one of the aspects of your uh, risk management. And last but most important part is the waste disposal. How we dispose waste. Somewhere people talk like your nose mask. If you throw it, you're not supposed to do that. You have to keep it at your house in a packed condition for 72 hours. Then no dispose it. Even then, I'm not sure that how do we prevent it from recycling? In a country like ours, a lot of recycling happens of the water bottles on the Rajdhani Express and other trains. Same thing happens to your nose mask. If you throw it in a garbage, somebody might be picking up, and after cleaning it may be sold in Chowdi Bazaar. How do you know? So one of my submission is whenever you're disposing such thing, you destroy it, cut it with a scissors in two part and whatever. So damage it so that it cannot be reused for the same purpose, number one. Secondly, in an industry where a lot of such waste is generated, the nose mask and all that, it has to be disposed of properly. We have to work on norms, think of it, even for incineration, you can go, but then think of the fumes coming out, it affects the environment. All these things have to be done with total responsibility, and everyone has to be careful about it. This is where I wish to close my statement. Thank you everybody for patient listening. Over